Greeting from Lviv, Ukraine. Today is the second day quarantine for the coronavirus in Lviv. I make this video about public hospitals. Why? I think it's useful now because for the coronavirus, for diagnosis or treatment, you will be sent to public hospital. And I want to give you some background about public hospitals. It's very hard for me to make this video because there's so much information I want to share and there's so much emotions, and I will try not to be negative. Also, why this video could be useful for you, because if you have friends in Ukraine and they say I'm in a hospital or my grandfather is in the hospital, you will understand better what it means. It's a very stressful time for us. Why this video could be useful for you, a third reason, is that I hope that soon the crisis will finish and the travel will resume, and when you will come to Lviv, you want to be prepared for any extra urgent situation if anything medical happens. So you need to understand this is the animal you might need to deal with. Where do I start? Okay, few words about COVID virus. We have a government infectious hospital. It's only one, but government is ready to expand and change the profile of 2 more hospitals in case of the situation escalates. But I advise you, for you, the best strategy is to stay healthy. You do not want to even deal with Ukrainian healthcare system. But in case, if anything happens, we will all survive. Everything will be fine. I have a question for you. Are you happy with your healthcare system? Did you ever have to use the emergency room, and how was it? I had to use the emergency room overseas. I was waiting. I had a head injury, and maybe you see the scar. My head was all covered in blood, and I was waiting. And I came to the nurse and I pushed them to take me. I fought my way to get care. So that was my experience. Ukrainian healthcare system is a very, very difficult, painful topic for us, and it's our weak spot. All former Soviet Union countries have reformed their healthcare system except Ukraine. We have a large number of hospitals, but the funding was geared towards, it was tied to beds, to a number of patients served. Polyclinics are large, there's primary care, there's gynecological or urology, there's neurology, there's also a surgeon there. You can see before you are sent to a tertiary level hospital. There's inpatient units in a polyclinic, in a primary level hospital. So hospital management was never taught to think in terms of patient satisfaction, in terms of health outcomes of a treatment. For example, Amosova Institute. Amosova was a heart surgeon. He was very famous. He has monuments for him, and the institute is named after him. That's the highest level of care. So on the 3rd floor, a surgeon saw a patient with a heart problem, and then he sent this patient to do ultrasound. Well, the ultrasound is on the 1st floor, and there's a small elevator that only takes 4 people, and that heart patient had to walk or wait just to get his diagnosis done. And guess what? The patient has to do it all himself. Only family members can help him. So when you do not feel good, this is really frustrating. The client of the hospital manager is the government, and a skillful Ukrainian manager is a doctor who knows how to flirt with the government and to lobby his interests and interests of the hospital, and to manage different stakeholders that are pushing on the hospital. There is a reason why Ukrainian healthcare system is the way it is. Many stakeholders have their interests. I will not discuss it. Now, making this video, I understand that healthcare systems are not perfect in many countries. For example, just recently, doctors in France, before the outbreak, were striking to raise their pay. Personally, what do? When I go, I do not have any health problems for many years, thanks to God. I'm very healthy. I just go for like checkups. And I always use second opinion. When doctor sees me, she says, "Ay, this is so bad, this is so bad. Here, take 6 pills and go do your labs and do your ultrasound, and then we will look at results and come back to me." And so I do all of this, and then I get second opinion, and I return to her, and she looks at me and she says, "You're fine, you're okay, you're healthy, go." The management of the hospital, is the management there? Does it know what's going on? Does it know what level of care patients are receiving? Who do they report to? Does Ukraine have medical guidelines? Yes, it does. But how do doctors follow medical guidelines? I don't know. Where do these guidelines come from? In my previous videos, I said that Ukraine has bright professionals, and this is true. We have medical university in Lviv, and we have a lot of gifted medics. The only problem that you might see in government hospital is that are the skills of doctor checked before he's hired? How the doctors are allowed to work in a hospital, under what conditions? Is his work checked? Is his medical practice checked? I'm not sure. I was accompanying a patient on a consultation. I was translating, and I was not happy about the level of consultation. Also, Ukrainian hospitals have donated equipment or like really old GE MRI scans that do not catch any problems when you clearly see a person has a problem. So that's why I say the funding is mismanaged, because you will see when you enter the hospital, or you can see from the video footage, the condition of the facilities. The equipment is so outdated, it's breaking, and the doctors do really a lot with these minimum resources. And it's very stressful for doctors, because besides worrying about patients, they have to worry about management, they have to worry about hospital politics, they have to worry about lack of equipment, they have to worry about double standard. For example, government promising testing kits for COVID virus and Lviv not getting them. This is one of the examples. In many instances, Ukrainian doctors, they change their qualification or they go overseas, and also nurses. We have shortage of nurses because they go overseas. And I just want to emphasize that this is nobody's fault but our own, because we are self-serving, egoistic, think about ourselves, and we do not worry about healthcare system because it's not every day that you deal with it. When some misfortune happens, it really hits you. So my main recommendation for you is to stay healthy, for you stay at home. I think that foreigners in Ukraine, they are well informed and they are very careful, and they know how to take care of their health. And then also, if Ukrainian is at the hospital, the family member is in hospital, you have to understand that it's a very stressful time for them. They are really stressing out, and they are multitasking to arrange help for the person. In general, I think that Ukrainian healthcare professionals are compassionate and they want to help. I've seen good doctors. Personally, I usually use second opinions, and I just stay healthy. I think you have to have faith, you have to believe in a doctor, and just believe, trust. And thank you for being interested in Ukraine. And I think positive things are happening in Ukraine, and they will happen. We have a lot of good, positive resources, and we just need to try a little bit harder to organize it. But at this point, for you, I recommend for you to take all the precautions not to get sick with the virus, and if you are in Lviv, in case of emergency, trust that everything will be okay. Also, I'm happy to help you and assist you personally for your specific case, to advise you about the city and advise anything that you need, and also you can get me to assist you when you arrive to the city. I'm the biggest lover of Lviv and Ukraine, and join my group of people who like the city, and no matter what, we stay positive, and I believe in positive changes. Are you healthy? Do you want my virus? Do you want my virus? Are you scared? You want to make video with me? You are so cute, you are so cute. Ну, дивись, як ми будемо з тобою зірки. Ну, дивись, які ми будемо з тобою. О, Макс!